Well, welcome back, everyone. This is Dr. Antonio Gandia. I'm here again with Braxton News, and we have a really special guest today and a friend of Braxton and all of us in EMS. Here we have Jamie Greene, who represents Henry Schein EMS. And actually, Jamie has a new, sort of an exciting product that us in emergency medicine, and clearly now moving on to pre-hospital emergency medicine, the portable ultrasound machine. You know, myself being an EMS medical director and both a emergency department medical director, you know, all guys are saying that this is probably the new stethoscope out in our industry. You know, one of the things that excites us about the ultrasound, especially in the pre-hospital arena, is how we can maybe make some quick diagnoses out in the field, just like we're doing with MIs and strokes. If we can pre-alert hospitals that there's blood in the belly or pneumothoraxes or even pericardial effusions. I mean, those are really sort of game changers to the hospital, because at least as an emergency physician, I know immediately what's coming in. I need to call the general surgeon, etc. You know, in a few places in our state, either the trauma hawks or the helicopters are now carrying blood. And if I look at it as such a game changer that if we're at the scene, we can make the diagnosis within 5-10 minutes. There's some blood in the abdomen. By the time the helicopter lands to the floor, all of a sudden the patient is getting blood, which is paramount to anything else. So with that, I'd like to introduce Jamie Greene, and he's going to give us a kind of a quick demonstration on this new product that the Henry Schein EMS is showing us here at the conference. Thank you. Jamie?
Thank you, Dr. Gandia. My thanks to Braxton News for this opportunity. So I have here the GE V-Scan handheld ultrasound, a new product rather to EMS, not necessarily new to the ultrasound world, but as Doc said, this is becoming a new tool for the industry, and the manufacturers are recognizing that, coming to the distributors of EMS to help us get it out to the field. So we go to the menu here. There's a lot of different options. I'm not going to take you through all of them, but just to hit on some of them. But we have preset examinations. We can start a protocol here. There's protocols listed. The beauty of this is that Dr. Gandia could write a custom protocol for his agency or his paramedics, and he could have that put in the machine for them to use when they're out on the street. So it's customizable. And again, it's got training videos in it. We'll go back to our menu here. And these are all different videos that you could be literally in the station wondering, okay, you know, how do I do a FAS or how do I do a cardiac? It will show you a video on how to do that.
Wonderful.
Okay, so it's a nice refresher tool. You don't have to have another class. They can be on duty refreshing themselves. Big question comes up in EMS is, can you transmit the data? And the short answer is yes. That's crucial to our industry, as you well know, to get that data to the receiving facility. And it can also be incorporated into that one report. That's the other thing, is people don't like sending 2 or 3 different pieces of a report to a facility. One report. We can do that with you. And if we can't do it with what currently exists, GE will gladly sit down with your technicians to make that happen.
Yeah, this is something like what we do with EKGs. You know, we talked about transmitting EKGs and so forth. I mean, it's amazing that we're able to transmit, you know, some of the images here, you know, to the trauma centers or to the emergency departments as a whole. Jamie, you know, this is a really cool probe that I've seen. You want to tell us a little bit about that? Because that's really a unique probe to this product.
Thank you, and I'm glad you brought that up. This is a dual transducer. Most of your ultrasounds that you'll see will have as many as 10 different probes that you could use. This one has 2, which are the most common. That's why they're there, the linear and then the cardiac. And just about 90% of the work you're going to do in the EMS setting, you can do with this one transducer, because again, it has a dual function. So GE has really thought this through for the end user. And again, this is meant as a quick look device. It doesn't replace, as we know, ultrasound or sonography, but it's a tool for the field to better treat our patients.
You know, one of the things also that I kind of like about this product is it's sort of all in one. Some other products you have to hook up to a phone or a tablet and so forth. This kind of comes all in one, and I think the probe is really ideal. You know, one of the things that we're doing at Braxton College, especially in our EMS division of Braxton College, is that we're incorporating this in our paramedic curriculum. It only takes just a few hours just to really introduce this to the folks, because just like we did years ago, introducing the 12-lead EKGs was a big deal. It's kind of shows you how old I am, but the point is that that was a big deal. And now, as I said, this is probably going to be a new stethoscope for the future. I have attendings that work in the emergency department that have one of these in their pockets. They use it just like they use a stethoscope. Again, Jamie, anything else you can tell us about this? We're a great believer in this product, and we certainly think this is really the future of both pre-hospital and emergency medicine as well.
Well, again, thank you for the opportunity. Again, that it is handheld. You can transmit the data. It is easy to operate. It really is. GE is 100% behind us. They'll provide on-site training, webinars, whatever you need to help you be fully functional with the device as well.
That's wonderful, and I encourage all of us to take advantage of all the online training and the on-site training as well. All these product manufacturers are tremendous about that, and they know how to train us better than I would, any of my residents or my EMS folks. Again, thanks everyone for joining us. This is Dr. Gandia from Braxton College, and again, thank you for joining us in Braxton News. And again, subscribe to our website, and we'll see you again. Thank you. Jamie, thank you so much.
Thank you, sir. Thank you.